My name is Ben. I'm a consultant for education support. I'm just going to present a short film today for you as educators in helping you to watch out for and deal with secondary trauma should you encounter it either in yourself or in colleagues. So, firstly then, what is secondary trauma? Well, I should really ask actually the question, what is trauma? And in this context, what we're talking about is a deeply distressing or disturbing event or experience that causes severe psychological shock. Okay, so trauma, physical trauma obviously is a wound that can lead to shock. Emotional psychological trauma is a really disturbing event or series of events that cause severe psychological shock and then pain. So a couple of examples might be looking after a student who has lost close relatives to COVID-19. Okay, that sort of bereavement at a very young age is often deeply traumatizing, and that is something that is likely to be experienced by the student. The secondary trauma is then potentially going to be experienced by the teachers who look after the student. Okay, another example might be looking after a student who is on the safeguarding register because they've got known violent or abusive family members, and the whole situation with lockdown has exacerbated that, and things might have happened, and that might also produce trauma in, obviously that is likely to produce trauma in the student, but it may well produce secondary trauma in the people who are looking after the student as well. Okay, so we define secondary trauma as the cumulative effect, so it's the effect that builds up and builds up on the helper of working with survivors of traumatic events or people who have just experienced traumatic events. It's the effect on the helper. Okay. And what secondary trauma will often lead to is what we call secondary traumatic stress, STS. Now, you don't have to remember that. The main thing to just bear in mind with secondary traumatic stress is it causes symptoms very similar to PTSD. Okay, and the key ones are these: an intrusive re-experiencing of the traumatic material. So this is what we often call flashbacks. You keep going back to thinking about maybe being told about what's happened to the student or imagining it. Okay, and that kind of really repeats on you. Avoidance. So it might be you start to avoid certain scenarios and situations that bring to mind what you have witnessed or what you've been told has happened. Okay, negative changes in beliefs and feelings is one of the key ones that I certainly have experienced. I'm a trauma specialist myself, and one of the big things for PTSD sufferers is this change in beliefs and feelings and a real loss of sort of meaning of life, etc. And this, of course, often can lead to anxiety and depression, which is one of the reasons why anxiety and depression are such an issue and such a problem with people who are struggling with PTSD. So that's really quite a key one, a real loss of meaning. And then the fourth key symptom for secondary traumatic stress is hyperarousal, what we call hyperarousal, which is, you're always alert, you're almost on a hair trigger, the littlest thing can set you off, yeah? And that is something that people who are experiencing secondary traumatic stress and PTSD both struggle with. Okay, so in terms of the research base, secondary traumatic stress has been heavily researched in, first of all, in first responders, nurses, physicians, doctors, mental health care workers, and indeed children of traumatized parents. But it was only recently, in kind of sort of from 2012 onwards, that they really kind of opened up the research into education and educators themselves. So that's good to see, because obviously, we don't want to overstate it and say that there's lots of educators who are traumatized. However, it is clearly something that is going to affect some educators. So from 2012 onwards, much more research into the effects of secondary trauma on educators. And obviously with the pandemic and the lockdown, this has made some factors worse. So for instance, we know that before the pandemic, teachers were often dealing with very high levels of trauma in their students from disadvantaged backgrounds, students who were suffering from abuse or neglect and stuff like that. And now we can also add, obviously, the untimely death of parents or loved ones, and also potentially domestic violence as well, because we know that the rate of that, unfortunately, is one of the really sad and awful statistics has really skyrocketed during the lockdown. Okay, so especially as education and teachers and you all prepare to go back to school in September, it is something that is really important to kind of bear in mind. Another thing that we found out from research is that women are more susceptible to suffering from secondary traumatic stress than are men, and that is seen as an example really of the fact that women often are able to show greater degree and levels of empathy than their male counterparts, and therefore they're more exposed to this secondary trauma coming in. Okay. So, I just want to talk about some other factors as well that are commonly associated with secondary trauma, and you will often hear them, sometimes you will hear them rather, being talked about almost interchangeably, not quite the same, so it's just important just to let you know about these. There's vicarious trauma, which often, again, people talk about in the same breath as secondary trauma, where it's very similar to secondary trauma, but it's a sort of transformation of a helper's inner world as a result of them engaging empathically with a person's traumatic experience. Okay, so the main difference between vicarious trauma and secondary traumatic stress is that there's one factor that changes, and that's the beliefs and feelings. Would you remember I said that was one of the factors, one of four for secondary traumatic stress? It's the one thing for vicarious trauma that changes. A person's inner beliefs and feelings, undergo a real sea change for the worse usually in vicarious traumatization. Okay, there's also compassion fatigue, which probably is a term that we're more familiar with. This is the reduced ability of supporters and carers to support after being exposed to suffering and distress. Okay, so this is something particularly to watch out for as educators. It can emerge and suddenly, compassion fatigue, suddenly you're full up and you have no more sort of you just feel numb and you're just not able to, and that can cause an issue, because then you're wondering as a teacher, for instance, why am I not able to empathically attune and support and feel what's going on for the student, and actually it might be that you're suffering from compassion fatigue. Okay, and then the last one, which is really applicable to education, is burnout. Again, it's kind of talked about in the same sort of dynamic as secondary trauma, vicarious trauma and compassion fatigue, because it is part of the stress process really, and this is a result of accumulated stress accompanied with a lack of accomplishment or belief in the work that you're doing. Okay, that's quite important actually for burnout. It tends to appear gradually, and it is a symptom of secondary traumatic stress rather than the other way around. Okay, so burnout can be a symptom of secondary traumatic stress, where you just that's it, you've had enough, and it goes with that loss of belief. Okay, so the other thing I just want to say before I say a few more things about burnout and how it might affect you as educators is that you might, as a teacher, experience all three of the above and secondary traumatic stress at different stages. Okay, you might have vicarious trauma, you might then go into compassion fatigue territory, and then you might end up with burnout is usually the end of the tree, as it were. Okay, so that's something else to bear in mind. Now, as educators, there are some other factors that feed burnout, which you guys should be aware of. Okay, and some I'm obviously not going to list all of them, but some examples of those might include guilt and worry. That some kids have not had any homeschooling whilst away, for instance. Okay, especially if you know as educators that these kids, students come from a difficult home or background. Okay, so that could be something that potentially feeds burnout. Supporting kids whose parents are frontline workers, okay, and therefore also supporting the anxiety, the fear of the kids for something that they have they have virtually no control over. Okay, so that can be really problematic. Worries maybe about colleagues who are self-isolating or who are having to shield because of the underlying conditions or because of their age or whatever. That is a possibility as well. It might be also that you as I've kind of just mentioned, as you hear some examples of hardship from your students and you feel absolutely powerless to do anything to help. Okay, and one for you head teachers, people in the senior management teams, maybe worrying about staff who have underlying conditions, and what's going to be the situation for them maybe in the autumn term when everyone comes back. So the key things are: be aware, okay, look after yourself, and access support. Those three things: be aware, which hopefully you will be by watching this video, look after yourself, and I'll remind you of some of the ways that you can do that, and just say, and access support, and similarly I will remind you of a couple of those as we move forward. Okay, so here we go, some ways to deal with the issues. The first one, organizations have ways, and that's really down to awareness, isn't it? It's on schools, colleges and establishments to provide awareness of secondary trauma. If you know about the problem, then you can deal with it. And we always say that in counselling, I'm a counselling psychologist, if you're aware of the problem, you are able to deal with it, okay? It might be through provision of counselling services. Maybe your school or college has an employee assistance program which provides counselling services. It might be through awareness initiatives and things like that. Okay, so that's really, really important. Then there's interventions, specific interventions, which organisations and individuals can potentially take. So one might be an organisational measure, which is a critical incident stress management, in the shape of debriefing or psychological first aid to groups of people who maybe have experienced trauma through something that's happened to maybe one of the students or something like that. Okay, so the organisation might be able to provide a critical incident stress management process. There's counselling, obviously, and a lot of organisations, a lot of the education or establishments and colleges and schools will have the counselling services. Some may not, so you might have to look elsewhere. Okay, and then there's specific therapeutic support for trauma, like EMDR, which is eye movement desensitization and reprocessing. I'm an EMDR qualified therapist, which is very efficient for helping people deal with trauma. Or indeed, there's also trauma-focused cognitive behavioural therapy. CBT is very popular, obviously, in the NHS and such like. And there's a particular version of it which is also very good for dealing with trauma. Trauma-focused CBT. Okay, so that's the interventions that can be taken at an organisational and individual level. Okay, then there's also self-care. And self-care really is down to you guys as individuals, all right? So we often talk about the 3 R's in self-care, and then the O, which is an organisational thing. Okay, the 3 R's are restorative self-care, which is all about how you keep your body in good shape, because if you're keeping yourself in good shape physically, then you are definitely building yourself up to be in better shape to deal with stuff on an emotional and psychological level. The two are very interlinked, okay, as I tell a lot of my clients. So exercise, gardening, walking, yoga, looking after your diet and stuff like that, okay? There's also recuperative self-care, which is what you're doing to help your mind, okay? So this might be self-help, it might be talking to loved ones, it could be mindfulness, which is a form of meditation, it could be reading, okay, stuff to keep your mind, puzzles, stuff to keep your mind ticking over, etc. Okay, and then there's recreative self-care, which is really about the communal stuff. Now, that would include holidays. Holidays potentially are going to be more possible as we move into the late summer. Okay, so that sort of thing. If you are not able to see friends, maybe you can Zoom them using technology, going out walking or picnicking with friends. Soon I think households will be able to link in, so all of that sort of stuff. So that's the recreational or recreative self-care as well. And then finally there's the organisational stuff, which I kind of mentioned. So but this would also include things like good support from your management and your managers, supervision maybe where necessary, training, awareness, peer support. Don't forget your colleagues can be a great support, and whatever other support that your institutions might have. Okay. Now, lastly, I want to end on a positive note here. As someone who has worked in the field of trauma for 11 years plus, there is something which often we find with people who recover from trauma, and that's whether that be direct trauma or secondary trauma, is that often surviving trauma leads to what we call post-traumatic growth, okay? And this has been, again, heavily researched, where people do experience, having got through this, and enhanced relationships through increased altruism, maybe having a higher value for friends and family and stuff like that. Improved view of self at the end of trauma, and that might be through an acceptance of one's own vulnerabilities and limits. Okay, and also a sense, you got through this trauma, so a sense of your personal resilience and your strength. And this is something that I always remind my clients at the end, my trauma clients at the end, is, you've got through this, and it makes them feel great, and they, it's, I've done that, and that can be really empowering. And then the other thing is positive changes in life philosophy can come about as a result of post-traumatic growth, and that might be through appreciating every day more. I wake up and the sun is shining, whatever it is. I'm in good health, and renegotiating the things that really matter. Okay, so it's a bit, I often like it, a bit like a bone that has been broken, and then it resets stronger than before. And people often report that, maybe you've had a metal implant put in there, it's actually stronger than before. And people often report this after coming through PTSD and certainly secondary traumatic stress, and actually indeed even coming through therapy. People often report that they just feel a bit stronger. So to conclude, okay, there is a possibility that some of you may have been exposed to secondary trauma, but there are ways to try and mitigate it. The main thing is for you to be aware, okay? And if you feel that this is you, get help, get support. There's many support services and resources out there for you. If you're watching this, you will be connected to Education Support, which is a fantastic source of support. So you can talk to us if you need help by calling the helpline, which is staffed by qualified and skilled practitioners, which is available to you night and day. Okay, you don't have to be in crisis. Maybe you can see a problem coming on the horizon. You might just want to talk about, what's going on, etc. Or maybe you see some sort of situation that potentially you could end up with secondary trauma with. Give us a shout and we can have a chat through with you. Okay, the details for Education Support are coming up. And finally, everyone, it's always a pleasure to talk to you about some of these things. But as always, stay well and stay safe.